Thank you, Mr. Hetrick. I just want to say that without the support and leadership we've received from the network office and throughout our medical centers across the network, a lot of the things that we've done wouldn't be possible. And we have a tremendous dedicated team in the field that's really taken on this task to end homelessness. It's a very big job. So I'm very proud to be a part of that. And I want to thank Justice Stratton for inviting us back for her wraparound. This is terrific to have a champion in Justice Stratton to support us. I'm going to make assumptions for the benefit of time here that many of you have already heard of our plan and aware of it, but just as a quick reminder, the plan was rolled out in 2009 from Secretary Shinseki. The message is that no veteran there should be no wrong door for a homeless veteran to get care, to get access to services that they need, and that the plan was centered around the 6 pillars: education and outreach, treatment, prevention, housing, support services, income and benefits, and community partnerships. I think one of the things to really emphasize about this is that the VA's plan to get to zero by 2015 is really dependent on the partnerships that we have with our community. I mean, that's the biggest key. There's a lot of resources that have been made available to the VA to provide us with the support to do this initiative. But as Mr. Hetrick said, Secretary Shinseki has really taken this on. He's asked good questions. And one of the primary questions is, how do we know where our homeless veterans are? We've had community partners that have been working with the veterans and providing services for a long time. One of the things that has been happening in the past in terms of looking at the number of homeless veterans that are out there is we have different systems that collected information different ways. The VA collected information according to what was done as an annual project challenge, which I can talk a little more about. And HUD has what's called an annual point-in-time count. The point-in-time count is done in January of every year. The last 10 days of the month, where the community collects the information and sends that information up to HUD to give an indication of how many homeless individuals are out there. Starting in, I think it was 2009, HUD required that continuums communities that are collecting that data collect data, including veteran-specific data, so that we could then get information about the number of homeless veterans that are out there. And this was just another one of the initiatives that's part of the initiative to identify how we're doing with this plan, which is using that point-in-time count that HUD collects on an annual basis. We have data from 2009. There was a refresh when we went to the HUD data, looking at the number of homeless veterans across the country. It was around 75,000. 2010, that went up slightly to about 76,000, and we believe that was in part due to some improved communication and coordination in terms of identifying veterans. In 2011, the number dropped significantly to 67,000. It's about 12% decrease nationwide. In our network, we saw about 16% decrease, from about 15,000 to about 12,000 across our network. So we have seen some real strides in our efforts to end homelessness among veterans. We haven't got the 2012 numbers yet. These were counts that were done last January. We're waiting for those to be released. However, some things that we are noticing from our discussions with our local communities that are providing us with some input in terms of the numbers that they're looking at. These are not total numbers, but we have seen that some of our communities, particularly in our balance of state, which I'll talk about here in a minute, have seen some increases in some numbers, particularly in unsheltered. Now, this is 2011 point-in-time count, and just as a quick education here, we have 8 communities across the network, across the state, that have what's called continuum of cares, and those continuum of cares collect that reporting data. The Ohio balance of state includes 80 counties, 80 of the 88 counties in Ohio that have an aggregate number, and it's included as one continuum for the state. So this continuum, balance of state continuum, has an impact on all of our medical centers. But the total count, again, is about 12,000 in the past year. The unsheltered count here, you can see these numbers. For the balance of state was about 35 unsheltered in the state of Ohio. numbers that I saw from Ohio Balance of State 2012, and those haven't been finalized, but it's a higher number. And so one of the things that we're going to be doing in the coming year is to make sure that the VA has a representative, somebody partnering up with each of those counties within the Balance of State to work with, so if they identify a veteran, we can be sure to get that veteran connected with services. The rural veteran population is a real challenge for ending homelessness because of the lack of services that are available in some of these communities, the kind of logistical issues that you have involved in terms of transportation and so forth, getting access to those individuals, plus identifying them, because if you don't have shelter beds in your community, how do you identify a homeless veteran unless they show up at your doorstep? So that's a real challenge for us. Looking at some of the resources that we have, we noted in the continuum point in time, there's sheltered and unsheltered. One of the things that the VA did in the past 2 years was to make sure that all of our VA resources, our community grant per diem beds, our homeless contract beds, our domiciliary beds, all of those kinds of beds, those resources that VA funds for homeless veterans are included in our community's inventory of beds that they use to identify homeless veterans, homeless individuals as well as homeless veterans. So you can look at our numbers of resources that we have, the beds. These are all beds that are included in what's called a homeless management, a homeless inventory, housing inventory chart for the communities. So what we're going to want to make sure that we're doing is making sure that we're keeping those beds occupied with veterans that are eligible for services if they're in need, rather than having empty beds. Make sure that our numbers of unsheltered veterans are going down as we continue to move forward and are working collaboratively to address the needs of these veterans to move them back into permanent housing. Very quickly, we have some data that I'm going to provide. This data, as Mr. Hetrick mentioned, we have a homeless registry that the VA collects. This is called our Homeless Operation Management Evaluation System. This was rolled out in 2011. It's a system where the VA collects internal data on the veterans that they're assessing across the spectrum of programs that we have. The homes data is not necessarily all homeless veterans. It's veterans that are involved in a homeless funded program or a program dedicated to assist homeless veterans or veterans at risk. So in terms of our outreach efforts, you can see here that we've had a tremendous increase in the past year. Part of this, the dip in 2011 and 2010, was getting to making adjustments in terms of how we were collecting the information, but we're continuing to make efforts to reach out to veterans. The other categories here are our contract beds that we have enrolled in HCHV. These are program beds to allow immediate access for homeless veterans. So if a veteran is found in a shelter, we can help connect them with a community partner that can provide some services and support to them, which would be short-term, maybe 90 days or less. So you can see that we've had an increase in the number of beds in the past couple of years there. Also, in terms of outreach, our homeless veterans, our homeless women veterans, you can see the number of women veterans that we've had increased. In 2012, we had a total of 369 homeless women veteran contacts, or women veterans that were seen in our programs, including 15 that were enrolled in one of our residential contract beds. In terms of the OEF program, we had a total of 371, a dramatic increase from 2011 to 2012. Again, one of the things that we're finding is that, as Mr. Hetrick mentioned, veterans who are aged 18 to 30 are at higher risk of becoming homeless compared to non-veterans. There was a study that was released, was provided to Congress in February of 2012 that indicated that many of our veterans are coming from rural areas, and those areas are also areas that we're finding that there's higher numbers of homeless veterans. So although most of homeless veterans are in our urban areas, we're still seeing a high number in rural areas, particularly in the younger veteran population. Finally, we have the call center. This was something that was rolled out in 2011. Just want to make a plug for that. This call center, as we've said before, is used to allow 24/7 access to any veteran, any individual family member who wants to report a veteran. It's a system of collecting information and making sure that that veteran gets connected. Out front, I have some keychains that I brought with us that have the call center number on it. So I wanted to share that, make sure that you take some of those home. The call center in 2012, we saw a tremendous increase in the volume of calls. Our network, we're still seeing a lower number of calls compared to some other networks, but we're tracking this, and this is an indication of how effective we are getting the word out and connecting veterans in our efforts. I'm going to skip through some of these other areas for sake of time, but I do want to get to our HUD-VASH program, and well, let me mention the prevention piece. Supportive Services for Veteran Families is a new initiative that the VA rolled out last year. There was $60 million in grants that were awarded. Cleveland received one grant at Mental Health Services, and this was the first project in our network that received a grant. They served a total of 524 individuals. 368 of those were veterans and 365 veteran families. So one of the benefits of this SSVF is the ability to provide assistance not just to the veteran, but to the veteran family, including children. Goodwill Industries received an award this past round. It was $100 million that was awarded, in addition to a renewal award to Mental Health Services. And there's going to be a NOFA out, Notice of Funding out pretty soon for another $300 million in grant awards this coming year. So we really want to get that word out for communities to consider applying for that. One of the pieces in this new NOFA that they're going to be looking at is to look at grants that are going to include pieces to provide legal assistance to homeless veterans and veteran families. So please, if you have any questions, let me know, and I'll talk to you more about that later. And then finally, our HUD-VASH program, as Mr. Hetrick mentioned, we have 1,125 vouchers that are allocated to public housing authorities that we work with, and the 39 case managers that provide case management assistance. We've done very well in the past year with this initiative, and I've got some data there that you can look at. At the end of the year, we finished off about 94% of the veterans that have received a voucher. These are vouchers that were released prior to April of 2012. But about 95% were leased up, which is tremendous. We've done a terrific job with that, and I really want to congratulate our field staff for that. And then the other items that we're going to mention here is employment. In May, we had a summit here in Columbus, and we really focused on employment initiatives that could assist homeless veterans. Employment is really a key piece to helping us to move forward with this initiative and sustain the gains that we've made. And we're going to be looking at some kind of partnership with ODRC and our CWT program and our reentry program. So we want to continue working on it, because veterans with felonies is particularly a challenging area for helping them to get employment assistance. I think I'm going to end there and pass it on. Well, I guess I should mention our challenge survey. Project Challenge, Community Homeless Assessment and Local Education Networking Group. This is an effort that the VA has to work with the community to identify needs of veterans in the community. This year, the challenge has a survey that's online. I've got the information there. You can also connect with that if you go to the VA's website, www.va.gov/homeless. We really encourage all of our community partners to provide input on the challenge survey. It takes about 5 minutes, and it's very valuable to help us understand what the needs are.